Hi, Sally Walker here, your hormone and slow age expert. So, what is pain? Good question, isn't it? So, pain is some kind of uncomfortable feeling. So, in an earlier blog, or last week I think it was actually, I was talking about emotions, I was talking about feelings. Well, pain is a feeling, isn't it? And, pain might be steady, it might be intermittent, it might be throbbing, it might be stabbing, it might be burning, it might be pinching, aching. We've got all kinds of different adjectives to describe the pain that we have. Pain tends to be in patterns as well. So I'm a physiotherapist, and I remember learning when I was studying that typical back pains or joint pains have a particular pattern. And if the pain is outside that pattern, then it might be suggesting that there might be some more serious pathology and we need to get the people back to the doctors. So pain has also some kind of pattern that it follows. Yeah, so why do we get pain? So the general consensus is that all pain, the origin of all pain really, is inflammation. And I'm pretty sure that is going to be really true. I'm not going to go against science here, but I will say that your perception of pain or how painful something isn't related to how much inflammation you have, but it is your perception. So there's a bit of a grey zone there really. So yes, inflammation will absolutely create pain, but your perception of the pain will make it more or less. So it's a double thing, isn't it, really? But if we just take the inflammation, if we just say, well, okay, so how do we treat pain? Well, we can treat both of the areas. We need to treat the inflammation, obviously, and we also need to treat the perception. And this can be done with medical drugs, basically. It can be done with the NSAIDs, so the NSAIDs, the non-steroid anti-inflammatory drugs, which are going to help decrease inflammation and thereby decrease pain. But we can also use opiates and possibly, though the jury is still out on this one, but possibly cannabis, which will also decrease your perception of pain so it doesn't feel as painful as it did before. Or a combination of these two. But they are medical drugs, most of these things, so you need to work with a doctor, obviously, because especially with the opiates, it's very, very important that you don't get too much, because we do not want the dependency or the addiction to become a problem. So we need enough of the opiates to decrease the perception of pain, but not enough of the opiates to get the hallucinations or the euphoria, etc., which you become dependent upon. So Dr. Tom talks about this on the radio show. So have a little look there, because he has a very big experience of working with the opiates, so he can explain things much better than me. But it's a very interesting area. I'm more the anti-inflammatory specialist, and there's a nice article down there about inflammation. So how you, through your lifestyle choices, can do something with the inflammation. Now, or decrease it, obviously. But there's one thing I need to tell you here, that it's not enough just to increase anti-inflammatories. It's not enough to increase the omega-3 fatty acids. You have to also decrease the inflammation. So you want as much as possible to find the cause of your inflammation and decrease that, treat that cause or remove that cause from your lifestyle, from your diet, etc., etc., at the same time as you're doing all the good anti-inflammatory things, because then you're going to get the best results, and you're also going to get long-term results, and you're not going to be dependent upon supplementation all the time. Anyway, a couple of articles down there, Pain 101 and the inflammation, so treating inflammation. So have a look at those and be much wiser about these things and make some changes. See if this can be enough to help your chronic pain. Happy hormones, happy life.